Rupture of membranes. So there are three terms that your provider may use to describe the rupture of your membranes, or in layman terms, the breaking of your water. We're going to take some time to go through those three, which are PROM, premature rupture of membranes, SROM, which is spontaneous rupture of membranes, and AROM, which is artificial rupture of membranes. All of these have different implications, and you may need to make decisions based upon which of these occur. So it's good to know kind of what those options are and what these stand for prior to labor beginning. So let's start with PROM. So PROM is premature rupture of membranes, and this is used to describe when your water breaks more than an hour before the onset of labor. The biggest concern with this is infection. Anytime your water breaks, the barrier between the outside world and your baby is no longer there, and they're at a higher risk of getting an infection. And so they want to see labor start as soon as possible. Each provider kind of has a limit that they're willing to work with, but typically within a few hours they're going to want to see labor starting and see something happening. Because of this and their desire to limit your risk of infection, they're going to want, and their desire to have labor start soon, they may use a variety of induction techniques in order to get things started. Most commonly they would use Pitocin, which is a synthetic form of oxytocin. It's used to cause labor contractions, and so they very likely can get you started on this in order to get your labor started. It may be a good idea at this time, again, to limit the risk of infection, to limit the number of vaginal checks that you receive. Again, any time that hands or objects are inserted into your vagina, that's just introducing bacteria in there and increases your chances of infection being transmitted. So limiting those may be something that you want to consider. Next is SROM, which is spontaneous rupture of membranes. This is when your water breaks on its own. A lot of times when we think about this, we think about that movie-style rupture where you're in the middle of the grocery store or wherever you are, and suddenly there's just this explosion of fluids. While that does occur to some women, more than likely, the majority of women actually experience a leak of some sort. It could be a small trickle, it could just be a slow leak, where you'll have to put a pad on to catch it. But either way, you'll just want to take note of that. It's important that, regardless of how your water breaks, to let your provider know when it occurs. It's a good idea to give them a call and give them the heads up that your water has broken. Again, because of that risk of infection, they want to see labor and progress in a certain amount of time. There are a few things that you want to keep an eye out for when your waters rupture. Again, the time that it does occur, whether it is a large gush or a slow leak. You'll also want to keep track of the color of it. It could be tinged with pink, it could be clear, or it could have brown or green coloring to it. So give your provider a call to let them know that information. And also the smell. Typically, amniotic fluid is either has no odor or a slightly sweet odor to it, and so if it comes out a little bit foul or fishy smelling, then that's something that you definitely want to notify them about. Next is AROM, which is artificial rupture of membranes. So with this, your provider is going to rupture your membrane. So they'll use a tool that looks like a crochet hook. It's just like a long stick with a little hook at the end of it, and that just snags onto your the amniotic sac, and with a tug it just ruptures it that way. There's a few reasons why you may want to consider having this done. Sometimes if the baby is high up in your pelvis still, and descent is just not happening, they may try to rupture your membranes in order to have baby descend a little bit. It's also an option to speed up labor if you don't want to try medication like Pitocin or things like that. Then this is an option that you can use as well. The rupturing of the membranes helps release hormones that trigger your body to stimulate contractions. So that's an option to keep in mind. So those are the three: premature rupture of membranes, spontaneous rupture of membranes, and artificial rupture of membranes.